something to do with the SI joint, that might tell us something to do with the lumbar spine. I mean, if I am both like that, right? So if I need to look at PSISs, I need to look at ASISs, and then I need to look at PSIS as related to the ASIS. So again, if I'm like this on both sides, that tells me I just have a flex posture or a anterior pelvic tilt, right? Or if I'm like that, that's a posterior pelvic tilt. And if it's bilateral, that's not an SI problem. Really, SI problems are usually unilateral, one further than the other, okay? So we're going to palpate those things. We're going to palpate the iliac crest height. So again, that's coming in and just coming down on the iliac crest. Again, if we had a situation like this, that might be considered an upslip, right? So if we had an iliac crest that was higher. And then we need to not necessarily palpate the medial malleoli when they're standing, but we're going to have to do that when they're lying down when we do this little test to kind of be able to identify where the medial malleoli is to kind of see if we have a leg length issue. All right? So we're going to look for symmetry. We're going to do that standing, all right? And then we're going to do it laying down. And so you probably might have all seen this little test, but we'll do it. Let's have somebody lay up here for just 1 second, and then we'll do this as a group. So someone lay on the back. So again, this is certainly not the end-all be-all test. This really is testing basically for anterior or posterior rotation. So I would have already taken a history, and they would have said something like, hey, I'm having SI pain, or I would have seen the doctor, or they would have given me that pointer that said it there. I might have even done the little march test that we're going to do here in just a second. I have already done a standing assessment of their posture and trying to see if I think this, but then if I think, well, they might tell me. Sometimes people say, hey, my pants usually don't fit right? This side always looks longer than this side. They tell you something along those lines. Obviously, the first thing I'm going to ask if they've had that situation, have you had any leg surgeries, right? Because it is possible if they've had a hip surgery or a knee surgery, if they had a broken bone when they were young, something through the growth plate, there's always a possibility that they have an actual leg length difference. So if they tell me something that they feel like their leg is different, I have to find out, is there a reason for that? If not, or if we get to this point, it's just a simple process of bringing them in this position. The only reason we have them bridge is just to kind of clear their hips, let it back down, and kind of, because if you cop up on the table, you might kind of already be cockeyed, right? So this just kind of lines things up, and then all we're going to do is straighten their legs down, right? And then we're going to try to get over them as much as we can so we get a good view. Like I said, I generally kind of take their shoes, bring them up. Again, we're not supposed to look at their shoes technically. It's a good starter, right? And then we're going to just visualize her medial malleoli. Again, I come down and kind of go to the first spot that I touch. That's where I stop. Again, sometimes people come up from the bottom. That's okay as well. Sometimes people find the most projecting piece of the malleoli. It doesn't really matter how you do it as long as you're consistent. So I'm going like that, and then again, I'm right over the top. And basically what I'm looking for, are my fingers doing that? If so, there's not a posterior anterior rotation. Or are they doing something like that or that, right? And again, this is where it's kind of funny. You'll kind of say it's a thumb longer. You don't use that as a diagnosis, or you don't really write that because it's not really measurable, right? We don't measure and say, hey, it's an inch or 2 inch, but you kind of get an idea of, it's not abnormal to have a little bit of leg difference, all right? People have a little bit of leg difference, but what we're not, if we're seeing it's a thumb length difference, that's significant, all right? So then after we find this, again, in her case, if I didn't see anything here and I really thought it was an SI problem, I go on up, and I'm going to need to find here that ASIS, and again, we want to kind of roll over. Same thing. I need to make sure I find the same spot on the ASIS here as I find here. So again, I'm going to find that spot, usually what I do is I kind of roll, and I just roll off the top, and that's where I put my finger. So once I just roll off the top, and then I'm going to do the other. Again, it's important that I get right up over the top of her. Otherwise, if I'm kind of like this, I'm going to have an altered view. So I'm here, and I'm basically just seeing, does what I see here match what I see here, all right? So that's generally for anterior or posterior rotation, right? So again, if I've seen something like this, right, obviously her knee's not bent, I would assume if all of her pain was on belly button. The other part of this, if I'm checking in flare and out flare, I'm basically just taking my finger from that same ASIS and I'm just kind of doing this. I'm just trying to mark and see, is there some symmetry in my motion from this side to this side? Or is this one way out here where I can't quite, it's not quite the same distance. So that's in flare and out flare. Usually use belly button for that, right? Kind of here to here, right? So let's palpate standing, then lay down, do the little SI assessment, which is the bridge, and look at the leg length. Palpate again at the medial malleoli, palpate at the ASIS, and then we'll stop there. We'll kind of work on the correct